comedian, actor, and game show host. What most of his fans do not know is that he is deathly afraid of germs. According to abc.news.go.com's article, Germs, No Deal for Host Howie Mandel, accessed on 10/24/12, Howie shares, I always have Purell at my desk. I'm soaked in it. I know a surgeon. I scrub my hands like a surgeon before and after the show. I have no antibodies on my hands. They're almost ridden with warts. I am a mess. In my mind, I'm always on the verge of death. Hand washing is the single most effective means of preventing bacteria-causing infection. According to the World Health Organization's website, accessed on 10/24/12, 2 million infections and 90,000 deaths in the United States alone are linked to inadequate hand hygiene. Some studies show less than 40% of healthcare workers comply with hand washing protocol. According to the Center for Disease Control and Prevention, it's estimated that more than 164 million school days are missed each year due to related illnesses. Many of those illnesses could have been avoided if children just simply wash their hands properly. I'm going to inform you of the origin of hand washing, the importance and protocol of hand washing, and what's being done to encourage hand washing today. So let's begin with the origin of hand washing. Hand washing is linked, according to the World Health Guidelines Guide to Hand Hygiene, back to religion. That's where it's first noted. Hand washing can be done for many different reasons, ritual reasons, hygiene obviously, but it's linked to religion. Many different religions, Islam, Sikhism, and Judaism, have notes in their holy text about hand washing. In Judaism, it's linked to food preparation and handling improper food that has not been blessed. So if you are a rabbi or if you are in a position of religious prestige, you are going to have a lot of experience with hand washing. The link between hand washing and medicine wasn't made until much later. This is Dr. Ignaz Semmelweis. He is the father of hand washing. According to Andrew Stewartson's article, Back to the Future, Rising to the Semmelweis Challenge of Hand Hygiene, published in August of 2011, it's stated that in mid-19th century, the doctor here was an obstetrician in Vienna, and what was occurring was there were a lot of deaths in the patients. After careful observation of the medical staff, he realized that there was no hand hygiene protocol. So patients that were delivering babies that had passed away were being examined, they were cadavers. That bacteria was being passed to the live patients during pelvic exams. Very, very bad. So he decided that he was going to implement protocol. So they adopted using chlorinated lime antiseptic solution in between hand washing, and those rates, the mortality was much better and was much improved. Over the past 30 years, that's when the most recent adaptations to hand hygiene protocol have been adopted. According to previously cited WHO.int, first the National Hand Hygiene Guidelines were published. Later on in the mid-90s, they were adapted. Many different countries follow suit to what the United States put into place. In the mid-90s, that's when it was adopted to use hand sanitizer or wash hands if you were dealing with a patient that had a suppressed immune system. Nowadays, the protocol that's being followed is less hand washing, more hand sanitizer, and hand washing is saved for specific instances such as surgical practices. Now that I've looked at the origins of hand washing, let's take a look at the importance and the protocols. According to the Center for Disease Prevention's website, accessed on 10/24/12, it tells us exactly when we should wash our hands and what the best way to do that is. First, it tells us we should use soap and clean running water. The way that we should wash our hands is for 20 seconds, washing in between the fingers, tops of the hands, backs of the hands, around our rings. That's a place that bacteria likes to hide for 20 seconds. If you need a reminder of how long 20 seconds is, it's recommended to sing the happy birthday song to yourself 2 times. If running water is not available, you may substitute an alcohol-based hand sanitizer. Please use a minimum of 60% alcohol. That That is going to get rid of most of the germs, but if your hands are visibly dirty, it's not going to get rid of all of them, but you'll be in decent shape. So when should we wash our hands? We should wash our hands before, after, and during any type of food preparation. Before we eat, when we're dealing with anyone that's sick or injured, when we're treating any type of wound or caring for someone that's wounded, after we go to the bathroom, when changing a diaper or cleaning up after someone who's gone to the bathroom, if we're coughing, sneezing, or around someone that's sick, interacting with these guys, not as cute as Rob's picture, animals, and handling any type of pet food or treats, that is when we should wash our hands. So now that I've established why hand washing is important and what the protocols are, let's take a look at what's being done to encourage hand washing. Right here we have a picture of Global Hand Washing Day. As you can see, there's 3 components. We have water, very important. We have soap, and we have hands. This is to spread awareness. Pretty simple. This is to spread awareness to use hand washing with soap and water. This particular holiday, or this observance day, is October 15th. We just missed it. And that's according to globalhandwashing.org, accessed on 10/24/12. There's another awareness campaign. This is called Healthy Schools, Healthy People. It's a SNAP. That goes back to what I said about the statistics with absenteeism in school. So this is to teach children the importance of hand washing to prevent those illnesses so they can come to school and it doesn't disrupt their learning process. We have looked at the importance of the practice and the origin of hand washing, the importance of protocol, and what's being done to encourage it. According to previously cited source, CDC.com, the Center for Disease Control and Prevention tells us that 9.4 million illnesses, nearly 56,000 hospitalizations, and more than 1,300 deaths are due to foodborne pathogens annually in the United States. And that's probably underreported. According to article Handy Solutions, Hygiene Compliance Monitoring Goes High-Tech, published in April 2012, we learned that hospitals experience an estimated 1.7 million healthcare-associated infections. That's when you go in well and you come back sick, or they pass it along to you. Not a very pleasant thing. And that annual cost is anywhere between $37 billion to $45 billion. And according to the CDC, nearly 100,000 deaths occur from those infections. That's pretty staggering. So I want you to look at the surface in front of you, whether it's a table or a chair. Did you know that the flu virus alone can maintain itself for 48 hours on that surface? Yeah. Look at your hands. Look at your hands. May not be visibly dirty, but bacteria likes to harbor on them for hours and hours. So, now that you know that, bacteria is no laughing matter and should be taken seriously. So let's go back to funny guy Howie Mandel for a moment. Now knowing what you know about hand washing, it may not be so difficult to understand where he's coming from. Some people may say obsession, other people may not say that anymore. It's not so far-fetched. And remember that wise old saying that tells us cleanliness is next to godliness. Thank you.